Today, we are going to discuss some common hernia questions patients ask during their office visits or they search on the internet. The first question is, what side of the body you should sleep on after having a hernia repair? Well, the short answer is it doesn't matter. Whether you had an inguinal hernia repair or any other sort of hernia repair, you can sleep on your back, you can sleep on a side, you can sleep on your belly. You will not hurt anything by doing that. The only problem with one position or another is the discomfort you may have, no restriction from that point of view. Another common question is, where is a hiatal hernia and where does it hurt? Hiatal hernias openings into the diaphragm, which is the muscle that separates our chest from the abdominal cavity. This diaphragm has some natural openings through which some organs pass up and down in our body, and one of these openings allows passage of the esophagus, which is the tube that brings the food from the mouth to the stomach, passage of the esophagus through this opening into the diaphragm so that the food can go down into the stomach, which is located in the abdomen. Now, that passage normally only accommodates the size of the esophagus. When that opening gets bigger, part of the stomach can squeeze in from the abdomen into the chest. Hiatal hernias typically do not hurt. Most common symptom associated with a hiatal hernia is gastroesophageal reflux disease, heartburn. But we have patients present with pain on the left side of the body or up here in what we call the epigastrium, and they think the pain is related to the hiatal hernia. It is very rare when hiatal hernias present with pain, and that typically happens when the stomach is above the diaphragm and it's a significant amount of stomach. There can be some twisting that can affect the blood supply to the stomach, and patients may experience pain either at rest or when they eat, and that usually doesn't just happen. It happens after years of people suffering with gastroesophageal reflux disease. Last question is, how can I prepare for hernia surgery? Is there anything I can do to speed up my recovery after surgery? Absolutely. The one thing you can do to help yourself and to speed up your recovery is exercise. It depends on the size of the hernia. Sometimes people have limitations if they have a very big bulge in the front of the abdomen, but whatever you can do will only benefit you. It will increase your physical performance, potentially lead to increasing the muscle mass, and that will only speed up your recovery. So you do not need to run a marathon, you do not need to do deadlifts at the gym. You can just do some simple exercises like lifting yourself on your tippy toes while holding onto a table, or getting a trash can and just doing some squats with a trash can in your hands. Those things, they may appear small, but they will make a big difference in terms of the amount of stamina you get and the ability for you to recover faster after surgery.